So we are now getting more of a preview for just how much healthcare premiums are going up in the Obamacare marketplaces for next year. We can put this tear sheet up on the screen. The news is very grim. Obamacare prices become public, highlighting big increases. So the Trump administration has released a preview of the available plans sold through Obamacare marketplaces in 30 states, giving Americans who buy their own health insurance a first look at just how much prices would go up. Insurers have increased rates significantly for next year, an average of about 30% for a typical plan in the 30 states where the federal government manages markets, and an average of 17% in states that run their own markets. That's according to a new analysis from Kaiser Family Foundation. Biggest impact for nearly all Americans covered by Obamacare plans will occur with the expiration of generous subsidies at the end of the year unless Congress extends them. Prices on the government website, healthcare.gov, reflect that change using calculations based on a return to the lower subsidy levels offered before 2021. So you have, across the board hit in terms of prices going up. And Saagar, part of what they point to, and we can get into, because I think it's still very murky why prices are going up so much at this point. Certainly some of it has to do with the Ozempic-style weight loss drugs, which have become incredibly popular, and also, by the way, incredibly impactful. The obesity rate is actually going down for like the first time in modern history. But you also have with this, they talk about how with the loss of the subsidies and prices going up, healthier people are going to drop out. That makes the cost higher for them. Sicker people stay in the pool. And so they are pricing in that expectation that healthier, younger people are going to drop out of the pool. And so everybody who remains is going to have to bear more.
I mean, it's rational. So ours are not yet public. They will be public, by the way, November 1st. I will personally post for all of you what it will cost for me, because I'm very curious actually to see what the actual increase will be. But I mean, this is a rational calculus. Let's say it starts to get to the $30,000 a year range, and you include a $14,000 deductible, which is what I currently have right now for the plan. That's 44 grand in the event of a like a bad thing happening to you. Maybe roll the dice. Just pay it in cash. I mean, honestly. And by the way, with cash, can't you negotiate? I've heard that before, that if you have a cash bill at a hospital, you can call them up and be like, hey, listen, I'll pay you 50 cents on the dollar. And they'll be like, oh, okay, we'll take it. Something like that, which shows you how fake the price is the entire time. Yeah, around 40, 50,000 bucks. I mean, it seems reasonable to just say, I'm not sure, not so sure, that we shouldn't just basically be self-insured. I mean, that's a horrible place to be. But you're out, if you're gonna be out the hole anyway for such an insane amount of money, you're basically buying like ultra disaster insurance at that point. And I don't think that the disaster insurance should cost $40,000 a year, right? Or $45,000 potentially in the event of a really bad situation. That is an entirely rational choice I would not fault really anyone from making. And I think, what we just can't get away from is this just shows you how bad Obamacare is. And it's one of those where with the whole subsidy conversation, it just seems missing for this entire it just seems missing from this entire discussion. Like, the subsidies only existed because of COVID. I think they're better than nothing. Rationally, people looked at the subsidy and said, oh, that's not affordable, but it's like more affordable.
Yeah.
Sounds so. They signed up and they actually had health insurance for the first time. What I do find very objectionable is not the GLP-1, but it does appear that many of the hospitals have been taking advantage of the newly amount of insured to increase their overall price for the services, and including for some of the drugs that have been negotiated, because remember, the PBMs and the interlocutors between all of this are squeezing every dollar that they possibly can. So the overall price has actually gone up as more people have entered this market-based insurance subsidy system. And so the ultimate reality that you arrive at is healthy people may leave the pool. The remaining number of people in the pool are either going to be sicker, who are going to be consuming more healthcare. That healthcare price is completely untethered from any market-based demand. And that's how you end up with 20% of your GDP spent on keeping people sick. It's an insane system, and it makes me so angry when I think about it. From housing and to this, I just don't know. Like, if you are, we talked previously, $25,000 per year, family of 4. What are we doing here? That's usury at a certain point.
Where are my AI savings? When's that gonna hit?
Yeah, if you're gonna deny people care, at least save me a fucking buck.
Yeah,
okay? Because I'm like, I can't deal with this anymore.
Where are the health insurance layoffs and then the accompanying reduction in premiums from all the money that you're saving? Somehow that's not filtering down to the consumer level. And they dig into who is gonna be most affected. So you have this group that makes 4 times the poverty level. They were the ones that were really the subsidies were expanded towards. So they're making $65,000 or more. That's all going to go away. So their premiums are the ones that are really going to skyrocket the most, from like a few $100s to multi-thousands of dollars. But people who are at the poverty line or near the poverty line, they are also going to see their costs go up significantly. Now, it's still an affordable amount if you make a reasonable income. But if you're at the poverty level, any sort of an increase is potentially dire for you. Potentially means the difference between you being able to have health insurance and not being able to have health insurance. The other thing that they're pointing to here, Saagar, is they're saying that this weekend, November 1st, is a kind of a key deadline. Because if you don't have some sort of a deal figured out in the shutdown, then they're going to price in the expectation that the subsidies are not going to continue, that the healthy people are going to drop out, that these premiums are in fact going to become reality. So, they're looking towards this weekend as really sort of like a key moment in order to, determine what's going to happen for the year going forward. Now, I will say the expansion of the subsidies was during COVID, was very successful in terms of, the uninsured rate is the lowest that it's ever been, I think. There were huge numbers of people who got into the Obamacare marketplaces because of these subsidies that were offered. So it was very successful in that way. But it means now that if those subsidies go away, you're going to have millions and millions of people who are really impacted, not to mention, like I said, the follow-on effects of premiums going up.
Yeah, let's go to the next one, because this highlights something that I'm very passionate about, which we did not even know, Krystal, until we became self-employed. So Marjorie Taylor Greene highlights this. This is for self-employed married parents in their 30s with 4 kids. They talk about Obamacare. She says Democrats did this to Obamacare 15 years ago. Johnson says Republicans have a mystery plan that is yet to be revealed to fix it. No one knows what it is. We're told to stay home in our district. She highlights this post from a guy, Mark Meredith. He says, these are the 9 options for health insurance in my zip code. Here are the 3 silver plans. The plans that he posts range from $3,655 per month to $3,810 per month. If you look at the deductible, it's $8,600, $12,000, and $3,000. The out-of-pocket maximum ranges from the low of $17,800 to $21,200. This is a Blue Cross Blue Shield plan for a family of 6 people. Now notice she mentions they're self-employed. I mean, one of the things that you and I discover, right, when you're self-employed is not only that nobody's going to give you health insurance, but you also have to pay like the full freight of Medicare and Social Security tax. So think about what this means for entrepreneurship. Like if you are somebody who wants to be an entrepreneur and to start your own business, which is allegedly the American dream, you actually are a lot worse off statistically in a lot of ways by taking this gamble, because $3,600 per year, how much is that annualized? I can't even do the math in my head. That's what, like $40K a year or something like that? Okay, so that's like $40,000 a year in after-tax income. Yes, it's tax deductible, off of the top, that you have to be able to bring home to make this nut before you make your mortgage or any of your other bill, not to mention profitability and paying for your employers or employees. So if you're self-employed, what is that, or if you were thinking about being self-employed and you're looking at this, what does that tell you? Healthcare attached to my job is worth a shitload of money to me. I may be better off staying at this W-2 that makes me miserable, because at least I don't have to carry the burden of the payroll tax and of the overall healthcare. That's really, I think, so bad, because it means it will just incentivize more concentration. Of course, Amazon and those other people, they have great healthcare because they can negotiate with the insurance company. They can provide preferential rates. So can any other large Fortune 500 company. Part of the reason why in American mythology we're always like, oh, go work at a big company is because of the benefits, right? But the benefits are a chain. It's slavery, basically, saying that you can't leave. And that's what I think we really need to highlight, because the lack of support, at the very least, it should be easier to start a new business. With the concentration of banks, health insurance, payroll tax, a lot of the other tax problems that exist for people who are small business owners, which we have discovered every single one of those in running this. It is not simple. It is not easy. And it can very easily drive you to a place of madness.
Yeah, it definitely takes out some of the dynamism from the economy, both in terms of, you know, people not being able to switch jobs because they're so terrified about their benefits, not wanting to go out on their own because they have to have health insurance. There is absolutely no doubt about it. I appreciate Marjorie Taylor Greene, you know, sounding the alarm on these things. I will say the solutions she's offered are the typical, like, price transparency, which is like, sure. That is not going to solve the problem.
I think we need price controls.
It has to be a much more radical solution. And listen, the left has been right about Obamacare from day one. Does it have some improvements over the prior system when you could just like get kicked off for any old reason and pre-existing conditions and all this nonsense? Yes. But even if it had a public option, that would have at least provided some competition in the marketplace. But what you really need is to go back to square one. And I understand how difficult that would be given how entrenched all of these interests are in our system, how much is built up around it, you know, how much I've seen people make the point of basically like, you know, countries, yes, we're the only developed country that doesn't have universal health care, but other countries developed this when things were simpler. And, you know, so it's going to be more difficult for us to do it. I'm sure that there is something to that, but how is this simple? Like, this is not sustainable either. So we're going to have to figure something out, and it's going to have to be something a lot more radical than like, we need price transparency, which is the only thing Republicans can really ever figure out
The United
how to
States
say.
spends 70% more of its GDP on healthcare than any other high-income country in the world without corresponding improvements in life expectancy or outcomes.
Spend more, get less, worse outcomes,
That's
and the literal incentive in the system is for you to be chronically ill.
Oh yeah, that's how they make money.
That is the incentive, because that's how you make money. So if you have a healthcare system that is driven around making money, you are going to have a lot of sick people, and lo and behold, we have a lot of sick people.
I talked about with this dialysis. I mean, I know I may sound like a broken record on dialysis, but does anybody appreciate how crazy it is that 1% of the entire U.S. federal budget is dialysis? 1%. Hundreds of billions of dollars a year spent on dialysis with nobody is thinking or doing anything about that. By the way, do you know how fucked up you have to be on dialysis in the first place? That means like 50 things have gone wrong, from obesity to, so preventative care. You're an end-stage renal disease at that point. That is how bad things, and that's how much money we have to spend. How much cheaper would it be to make sure, hey, let's just make sure people aren't fat in the first place? Over 40% of people on dialysis are morbidly obese. The vast majority are extremely unhealthy in many other areas. Many have not had any health care in the previous number of years. It would be so much cheaper just to make sure, hey, never go on dialysis in the first place. And instead, these dialysis clinics, I forget the name exactly of it, these are multi-billionaires who are running this place. You know how sick that is? Statins, you know, and all the other drugs that people have to take for the rest of their lives after they already have blood pressure or heart problems. Yeah, who's paying for that, right? It's just better not to have that problem in the first place. Diabetes, insulin. We know yes, insulin prices are bad. You know what's better? Not needing insulin in the first place. How do you do that? Don't get fat. Have some preventative pre-diabetic work. Something like 70% of the U.S. population is on the road to pre-diabetes.
GLP-1 may help with that.
Yeah, that's interesting though, but this also highlights the cost issue. B5, please, on the screen. So for the first time, actually ever, this is about the U.S. obesity rate. It peaked at 40% in 2022. It's now at 37. Now, how did it get to 37? Well, a number of people are using these GLP-1 drugs is now at some 12% of the overall U.S. population.
I think it's the beef tallow fry.
Yeah, it's Steak and Shake. Actually, it's Steak and Shake. However, you can still see it only dropped by 2%.
Okay, but we're headed in the right direction.
Yeah, did you notice how it went from 33 before the pandemic to 39 after the pandemic, and now it dropped by 2? So what does that mean? It's like, yeah, it's nice, we dropped by 2. We're still not even on track to get down to 33. And a lot of these GLP-1 drugs are being paid for out of pocket by people who have obviously a modest amount of income. I mean, from what I've seen from the ads, it's, what is it, like a couple $100 a month? I mean, it's a lot of money, but it's not gonna break the bank. Like, it's not like plastic surgery or something.
It's not like
that.
Health insurance premium
it's
kind
not
of
like
money.
Health insurance premium, exactly right. And, you know, if anything, it probably could save you for it. So insurance is not covering it. It is covering it in some instances, but they're paying absolutely insane amounts of money for that coverage, and it's still not shit showing up from where we are. And I think it makes sense because the obesity rate was something like 40%, and now it's only dropped to 37. It used to be at 33 something like 6-7 years ago. We can get back to that, maybe. You know, I'm not at this. I used to be against GLP-1. I still think I am for children, for anybody under like 25 years old, just because I think messing with the guts of children and all of that is still very scary, and we don't know the long-term implications of that. But I do think it is clear, like for obesity, it just needs to be all hands on deck to make sure that this is crushed as soon as humanly possible, because it will bankrupt us, it will bankrupt you, beyond the money, which, you know, whatever, that's replaceable, is it will destroy your health. And there's just not, again, you know, for all the talk of MAHA and all of that, et cetera, this is the structural stuff that actually keeps people deeply, deeply unhealthy. Yeah. It's really bad.
Yeah, no, you're absolutely right. A golf YouTuber, actually, a young guy in his 30s, 35, something like that Kyle watched.
Oh, I know what you're talking about.
Yeah.
Beef, the guy from Barstool. Yeah.
Big guy, and just died. And so
yeah, I don't know what that was about, but they didn't release the cause of death. But they did say it was an unexpected medical issue, I think.
Yeah. So I mean, it's, look, the health consequences in the way that being, you know, morbidly obese limits what you're able to do in the world. You know, it is absolutely an emergency. So I'm glad to see that at least there's some movement in the right direction, because it just felt hopeless for so long. But I was just looking, the cost out of pocket for the generic versions is like a few $100s a month. Insurers mostly only cover it when it's like directly linked to diabetes or something like that. So if it's like, you know, a vanity project.
Yeah, do you understand how stupid that is? It's only once you're diabetic that they'll pay for it.
Right.
Wouldn't it be better to not get diabetic?
Yes.
See, this is the sickness in the system. It's like this for everything. Oh man, I could go on forever, but it is something that's just, you know, from the dialysis, from the amount of money that is spent every year, and it's not like it's abstract money. It's taxpayer dollars in a lot of ways that funnels this entire system. The billionaires and the multimillionaires that it mints all throughout, you know, all of this. For what end? And yeah, I get it. It's trite. We've been talking about it for 20 years, but it's literally an imminent crisis with this healthcare premium expiring. There are going to be vast numbers of people that are just going to be uninsured, period.
Yeah.
And like I said, if it comes to the $45,000 mark, I'm probably going to roll the dice. I probably just go uninsured. And I mean, why? You'd be stupid not to.
And life expectancy continues to go down. And like this, you know, this ties into that story as well.
Right. Hey, if you like that video, hit the like button or leave a comment below. It really helps get the show to more people.
And if you'd like to get the full show ad-free and in your inbox every morning, you can sign up at breakingpoints.com.
That's right. Get the full show, help support the future of independent media at breakingpoints.com.